Postpartum depression, often abbreviated as PPD, is one of the most misunderstood and underdiscussed mental health conditions affecting women after childbirth. While society frequently portrays motherhood as a joyful, magical time filled with love and excitement, the reality is that many mothers experience overwhelming sadness, anxiety, and emotional disconnection during the weeks or months following the birth of their baby. Postpartum depression is far more than temporary mood swings. It is a serious and complex mental health condition that deserves understanding, compassion, and professional care. In this video, we will explore what postpartum depression truly is, why it happens, what symptoms to watch for, and why early support is so important. After childbirth, a mother's body undergoes dramatic hormonal changes. Levels of estrogen and progesterone drop sharply within hours after birth, creating a chemical shift that can significantly affect mood and emotional well-being. At the same time, the mother is physically recovering from childbirth, adjusting to breastfeeding if she chooses to do so, and adapting to interrupted sleep cycles. These biological and physical changes are powerful enough to impact any woman's emotional stability. For some, they lead to what is commonly known as baby blues, which involves mild mood swings, tearfulness, and irritability that typically resolve within 1 to 2 weeks. However, when these emotional symptoms become more intense, last longer, or interfere with daily functioning, they may indicate postpartum depression. Postpartum depression introduces a wide range of symptoms that vary from person to person. Many mothers experience persistent sadness or emotional numbness, feeling unable to connect with the joy they expected to feel. Others develop overwhelming anxiety, constantly worrying about the baby's safety or fearing that something terrible might happen. Some mothers may feel detached from their baby, unable to bond despite wanting to love and protect them. Feelings of guilt are extremely common. A mother may think she is failing, may feel ashamed of her emotions, or may believe she is not a good mother. These thoughts are not reflections of truth, but symptoms of the condition itself. Fatigue is another major symptom. All new mothers feel tired, but in postpartum depression, the exhaustion is deeper, more persistent, and not relieved by rest. A mother may struggle to get out of bed, lose motivation to care for herself, or feel overwhelmed by simple tasks like washing a bottle or rocking the baby to sleep. Sleep disturbances are also prevalent. Some mothers can't fall asleep even when the baby is resting, while others may oversleep, using sleep as a way to escape emotional pain. Appetite changes can include either eating too little or overeating for comfort. These physical symptoms can make emotional recovery even more challenging. Postpartum depression also affects cognitive and emotional functioning. A mother may have trouble concentrating, making decisions, or remembering daily tasks. She might feel emotionally distant from her partner or other children, and she may withdraw from relationships because she feels misunderstood or overwhelmed. In more severe cases, postpartum depression can lead to intrusive thoughts or fears of harming oneself or the baby. These thoughts do not mean the mother wants to cause harm. Rather, they are symptoms of intense anxiety and distress that require immediate professional attention. One of the most painful aspects of postpartum depression is that it often goes unseen. Many mothers hide their symptoms because they feel ashamed or fear being judged. Society often expects new mothers to feel grateful, happy, and strong, making it difficult for women to admit they are struggling. This silence creates isolation, and isolation deepens the emotional burden. Even family members may misunderstand what the mother is experiencing, assuming she is just tired or overwhelmed. Without awareness and support, postpartum depression can persist for months or even longer. Several risk factors increase the likelihood of experiencing postpartum depression. These include a history of depression or anxiety, stressful life events during pregnancy, complications during childbirth, lack of emotional or practical support, financial pressure, or relationship difficulties. However, postpartum depression can affect any mother, even those with strong support networks, planned pregnancies, and no history of mental health issues. It is not a sign of weakness or failure. It is a health condition influenced by physical, psychological, and environmental factors. Understanding and recognizing postpartum depression early is essential. The earlier a mother receives care, the quicker and more effective her recovery can be. Treatment options vary depending on the severity of the symptoms. Therapy, especially cognitive behavioral therapy, helps mothers understand and manage negative thoughts and emotions. Medication may be recommended when symptoms are moderate to severe or when therapy alone is not enough. Support from partners, family members, and friends is also crucial. Emotional support can involve listening without judgment, encouraging rest, helping with household tasks, offering reassurance, and supporting the mother's need for professional help. Self-care also plays an important role in recovery. Mothers with postpartum depression often neglect their own needs, focusing entirely on the baby. Encouraging small daily habits, like taking a walk, eating nutritious meals, connecting with supportive people, or practicing relaxation techniques can slowly help rebuild emotional strength. Rest is essential, as sleep deprivation makes symptoms far worse. Small adjustments, like sharing nighttime baby duties or scheduling moments of uninterrupted rest, can make a significant difference. Postpartum depression is a treatable condition, but healing takes time. Recovery is not linear. Some days will feel better, others more difficult. What matters is having consistent support and understanding. Many mothers who receive appropriate care go on to feel healthy, connected, and confident again. The journey is not about snapping out of it, but about understanding that postpartum depression is an illness, not a choice. It is important to end with a message of compassion. If you are a mother experiencing postpartum depression, or if you know someone who might be struggling, remember that you are not alone. Postpartum depression is common, real, and nothing to be ashamed of. Asking for help is a sign of strength. With the right treatment and support, recovery is not only possible, it is expected. Every mother deserves care, healing, and hope.